In this video, we are going to talk about flucytosine. Remember in the previous video on amphotericin B, I said this drug, flucytosine, has a synergistic effect with amphotericin B. So if you haven't watched our amphotericin video, please just click the link on the top right corner and watch that video first. Right, so this drug was actually discovered around 1957 during a research for anti-neoplastic agents. And of course, it was seen that it doesn't have those anti-cancer properties, but it was found to be a potent antifungal agent. Flucytosine is a water-soluble pyrimidine analog, right? So it's called a fluorinated pyrimidine. Its spectrum of action is much narrower than that of amphotericin B. This drug is well absorbed and distributed. It's available orally, so we prefer to use it orally, but there are IV formulations as well. It penetrates into the cerebrospinal fluid, right? So approximately 75% of the serum level will actually reach the CSF, which is actually good in our management of cryptococcal meningitis. And it also penetrates well into the aqueous humor inside the eye, the joints, the bronchial secretions, peritoneal fluid, brain, bile, and blood. You can see it goes almost everywhere, right? So this will also be important when we talk about the side effect profile, right? It's excreted renally, with approximately 90% of it being excreted unchanged in the urine. So in patients with renal impairment, we need renally adjusted doses. Its bioavailability is good, 80 to 90%. Here I just gave you the dose which most guidelines are using, right? So in the treatment of cryptococcal meningitis, for example, is given 100 milligrams per kg per day in 4 divided doses. So these 4 divided doses, the reason is being that the half-life of flucytosine is approximately 3 to 6 hours. That is in a patient with a normal renal function, but it could actually increase to 200 hours in patients with renal failure. So actually you have to confirm with the literature, but this is just insane, right? And let's talk about its mechanism, right? So flucytosine is taken up by fungal cells via the enzyme cytosine permease, right? So cytosine permease, we don't have that. Humans, we don't have that, but fungal, it's there, right? Okay, let's continue. Right? So inside the fungal cell, it is converted to 5-fluorouracil, and 5-fluorouracil is further metabolized to 5-fluorodeoxyuridine monophosphate, or FDUMP, and another active metabolite is fluoridine triphosphate or FUTP, right? So FDUMP and FUTP will inhibit DNA and RNA synthesis respectively. What am I saying? I'm saying 5-fluorodeoxyuridine will inhibit DNA synthesis, and fluoridine triphosphate will inhibit RNA synthesis. But just to remember, in MCQs, they can just ask you like which enzyme is targeted by flucytosine. That would be thiamidylate synthase, something like that. Thiamidylate synthase. Right. So as I mentioned, the human cells cannot convert flucytosine to its active metabolites. This will ensure selective toxicity, and this selectivity will make flucytosine an excellent and effective antifungal agent. Right. Flucytosine will demonstrate synergy with amphotericin B, both in vitro and in vivo studies, and this synergistic effect. Okay, let me just show you what's happening here, right? So this is the cell membrane, right? So you remember what amphotericin B does? It makes these pores, right? So it's make a pore allowing the flucytosine to get inside, and then flucytosine will easily find its way into the nucleus where it affects the DNA and RNA synthesis, right? So combined therapy can improve treatment outcomes for fungal infections, and the use of flucytosine alongside with amphotericin B can help counteract the resistance. As I always say, two is better than one. And understanding the mechanisms of synergy is important for optimizing antifungal regimens. And careful monitoring is essential when using flucytosine in combination with other drugs, right? Okay, so this is just the mechanism which I just explained. When do we use flucytosine? Flucytosine is first-line therapy for treatment of meningococcal meningitis. It's used together with amphotericin B and fluconazole. It's also used against Candida species and fungal organisms responsible for chromomycosis. And if you combine amphotericin B with flucytosine, that will reduce the occurrence of resistance, right? It can also be combined with fluconazole, which is another drug that we will be talking about in the management of a patient with cryptococcal meningitis. The mechanism of resistance, right? So resistance is thought to be mediated through altered metabolism of flucytosine, right? Although this is uncommon in primary isolate, it develops rapidly in the course of flucytosine monotherapy, right? So if you use it alone, yeah, that could cause that could lead to resistance. But if you use it in combination, the resistance is very rare. Uh, let's talk about the side effects profile, right? So the adverse effects of flucytosine, well, we can all thank this active metabolite fluorouracil, right? So this is responsible for almost all the side effects we will talk about. The first one is bone marrow toxicity, right? So bone marrow toxicity will lead to anemia, leukopenia, thrombocytopenia, right? Is bone marrow suppressing drug. Next is renal function, right? So in the kidney, it will increase blood urea nitrogen and uh, serum creatinine, right? So that's how it affects the renal function. In the liver, it could actually lead to elevated liver enzymes and bilirubin, hepatic dysfunction. The patient can develop jaundice, liver necrosis, and in the gastrointestinal tract, in rare cases, it could actually be fatal, right? It consists of anorexia, abdominal bloating, abdominal pain, diarrhea, dry mouth, duodenal ulcers, GI hemorrhage, nausea, vomiting. Ulcerative colitis is actually important in that regard. So just check in the literature the relationship between ulcerative colitis and the use of flucytosine. If you enjoyed watching this video, please make sure you give it a thumbs up, subscribe, and leave a comment in the comments section to tell me what you think. Until next time.